Hello everyone, welcome to my channel. Today's topic is for fourth year. Title is Characteristics of a Professional Nurse. Let's find out what is in the topic. First of all, a brief introduction about the topic. Nurse uses various skill in our day-to-day life. Nurse uses cognitive skill, technical skill, caring skill, ethical, legal skills in order to work in day-to-day life. That can result in knowledgeable and effective care. So, nurses should consume a set of characteristics to perform daily work, day-to-day work. First is caregiver. As a caregiver, it is responsibility of nurse to combine both art and science of nursing to meet the physical, emotional, intellectual, socio-cultural, and spiritual needs of the patient. So, as a caregiver, the nurse integrates, combines the role of communicator, teacher, counselor, leader, researcher, and also advocate to promote wellness through activities that prevent illness, restore health, and facilitate coping with disability or death. As a communicator, the nurse uses effective interpersonal communication skills, which is also known as therapeutic communication skills, to establish and maintain helping relationship with the patient, also with the patient's family. In all kind of healthcare settings, may it be hospital, may it be college, community, or any other nursing homes, nurse should be a communicator to to provide message to the patient about what care she is going to provide. As an educator, the nurse conveys her knowledge towards the patient and family, knowledge about everything that she knows, knowledge about patient's health, patient's diet, rest, sleep, patient's care, and as well as family's care. The nurse becomes an educator. She uses her communication skills. She evaluates individualized teaching plans, and by doing all that, overall, nurses meet the learning needs of the patient and their families. Nurse is also a counselor. Counseling is communicating to the patient therapeutically. So nurses is educated and trained to provide therapeutic communication in order to help the patient solve their problem. In some cases, nurse herself should solve the problem, while in some cases, nurses just help the patient to solve their problem and they solve their problem by themselves. As a leader, nurse acts as a leader many times during our work. Leading something means that requires self-confidence, that requires practice, that requires tactfulness and assertiveness, so that while providing care, that care can be effective for the patient. Leading also, this leader quality is also needed among the nurses. The nurse should lead her team so that the set goals can be achieved. As a researcher, research is basically solving the problem, solving any kind of problem, finding gaps in knowledge and solving the problem. So wherever there is problem in the field of nursing, nurse finds out that problem, conducts research on that problem, and fulfills the knowledge gap wherever that is required. Outcome of that research can be conveyed as a message towards the patient, towards the public, and among the nurses also. So nurse should be a researcher. Nurse should possess these characteristics of a researcher. As an advocate, nurse contributes in protection of human rights of the patients. While practicing nursing care, nurses should make sure that they are protecting human rights of the patients. Nurses should also make sure that they are taking informed consent with the patient and they are letting them make their own decision. They are letting patient and family make their own decision. Next is intelligent and skillful personality. This is this is a personal characteristic as well as professional characteristic. Nurses offer a scientific rationale for every care she provides, may it be bed making, may it be oral care, may it be perineal care, or anything. Nurses always has a scientific rationale behind her care. And nurses select the best intervention among all the interventions so that she can obtain desired outcome however she likes, whatever she likes, and whatever is best for the patient. Nurses also use critical thinking while solving the problem. That might be nurse's problem, that might be patient's problem, or that problem might be related to both. But nurses uses critical thinking to solve the problem. Also, being skillful means being handful on technology. There are many technical equipments that nurses should use on a daily basis. So, nurse should be skillful enough to make sure that she uses all the gadgets, all the equipments skillfully, and that her use of gadgets, use of equipments should give minimal distress to participants involved, to the patient, to herself, to hospital, to everybody. Thank you so much for watching. This is the end of the video. This unit will be completed. This unit will be continued in next video.